Hi everyone and welcome to Learning Plan 2. This is probably one of the more controversial learning plans just in terms of the material. We're certainly talking about attachment, which we know now is the cornerstone of development for kids, that it starts from within the utero, the feelings that the mother has regarding the pregnancy. Was it planned or unplanned? Did she connect with the baby? Does she want the baby? Um, those sorts of feelings start forming from the moment a woman finds out that she's pregnant. And certainly the choices that she makes while she's pregnant have an impact on that child. We now know a lot more about birth, what types of birth and what types of situations at birth allow for that infant bonding with their caregiver, particularly the mother. What happens when that bonding doesn't occur, either due to separation, postpartum depression, mental health issues, drug abuse, neglect, abuse? What happens when that bonding doesn't occur? Um, there have been significant amount of studies that show that when bonding and attachment doesn't occur, that the child really struggles throughout life. Much of the disorders, criminal behavior, and drug use often have roots within attachment. Um, and we can learn a lot about a child through their displays of attachment, whether secure, disorganized, etc. So in this learning plan, you'll learn a bit about attachment. Certainly, you've probably covered this in other psychology courses, but I think the difference in this course is understanding the risk that not having a significant attachment poses to a child. Um, that we can trace a disorder's roots back to the relationship, often between a caregiver, oftentimes a mother, and what that attachment looks like and what that relationship did well or not well for the child. So keeping in mind that attachment is really a cornerstone, a building block to life, and a risk and protective factor depending on how you want to look at it. Having a poor attachment factor, we would determine, is a risk for a child to later develop substance use issues, mental health, all of those different things. So keeping that in mind as well. From attachment, we move on to normal brain development, meeting milestones developmentally, socially, emotionally, things like that. We also talk about sexual behavior. The reason I've spent emphasis in this particular course is understanding what is normal sexual behavior so that we're able to detect what isn't normal. Oftentimes, if we see a 4 or 5-year-old exploring their genitals or asking about genitals or asking to see someone else's parts, it alarms us. Keeping in mind that that's entirely normal, it's when the behavior changes to become more sexually motivated, then we have concerns. So keeping in mind what is normal and appropriate sexual development and what is abnormal. And the biggest thing about this learning plan is to understand that we need to be truthful with our children, giving them boundaries within their age limits, giving them information that they need to keep them safe, and that our role as helping professionals, parents, and caregivers is to be that component in our children's life and not expect other people to fulfill that role. So with that being said, certainly the video that's in this learning plan, many have found controversial. But I think the first time that I watched it, I felt very much the same way. What in the world is this video? No child should ever watch this. It's borderline pornography, etc. But I think it's recognizing the premise behind this video. And caveat may I mind you, I think it was made in the 1970s, so it's relatively old. Is just saying that what are we teaching our children? Are we teaching our children that babies get made by holding hands? Or when it's age appropriate, are we telling them how they really get made? Certainly, I've mentioned in several different posts that my daughter, who's almost 5, has questions about my baby and how this got there. And I'm not lying to her, but I'm also being discretionary about the fact that she's 4.5 and there's some things she doesn't need to know yet. But also setting that foundation of you can come to me for answers that are embedded in truth, and that are developmentally appropriate. The biggest thing I will say is I've worked in the area of sexual abuse for many, many years. And it's very difficult to work with children who have not been taught the proper names of their body parts, who have not been taught boundaries about their sexual body parts, about their personal space. Even certain things, um, is if your daughter or son doesn't want to give grandma a hug, don't force them to do that, because that's them establishing boundaries within their body and what physical touch feels okay or not okay. Same thing if you're tickling your child and they ask you to stop, you stop. If they, they ask for a hug and they don't want one, you stop. So things like that that we can start really early on teaching our children physical boundaries, and sexual boundaries and when it is okay and when it's not okay. Teaching them the truth about their body parts from early on rather than giving them pet names. Oftentimes, this really reestablishes and kind of ingrains the fact that their body parts are not shameful, especially not their sexual body parts. And we teach them who can touch their body parts and when is it okay to touch those body parts. And they're going to start to want to explore privacy and all of those sorts of things. So it's really just truly encompassing what is the foundation of our bodies and our sexual parts and what's okay and what's not okay. So that's kind of the cornerstone also of this learning plan, probably something a little bit different as far as than we've learned about in other developmental psych and psych courses. Keeping in mind that we all bring our own experiences to the table. Oftentimes our interactions with kids in regard to sexuality, it's ourselves that we're uncomfortable with. And so that uncomfortableness is projected upon our children and the children that we're working with. Chances are, if we're uncomfortable with it, we're going to project that and it's going to be uncomfortable for us to work through it. So I think this is a great learning plan for us to think about the way in which we grew up and how that has shaped what we think about sex and sexuality. Now, keeping in mind, this is not a learning plan to discuss sex education. Okay, so clearly we can say that there's the abstinence only theory, there's sex education. That is not what this learning plan is about. So I want to make sure we don't get caught in that argument. This is just about how do we, as helping professionals, identify sexual abuse and overly sexual behavior? How do we teach um, boundaries and protective behaviors? How do we teach our children proper body parts? So I just want to make sure we don't get those things confused. We're going to talk about brain development through a series of videos, keeping in mind that the brain is constantly developing. The most critical years are the ages of 0 to 5. Super critical years for kiddos. Great places to provide interventions. That's why the programs like Birth to 3 are so important and so crucial. But keeping in mind that as parents, we have a tremendous ability to shape those formative years. But also keeping in mind that the brain does not stop maturation until 25. So oftentimes when we're dealing with an adolescent at 15 who their world is crashing that day and we think, oh my goodness, a year from now won't matter, they aren't able to see those things. All they see in the moment is that year. So we have to be careful about that in the way in which we shape choices, in the way in which we give options to kids, only allowing them what they're able to make healthy choices for. So giving them responsibility, but also recognizing what that responsibility looks like. So I hope you enjoy this learning plan. It's a great place to dive off and get started.